So when we think about the cost of care in the United States, compared to other developed nations, there's a lot of very public data about this. I think we spend on average $8,500 per year per capita, something in that neighborhood, for the total cost of care, roughly 18% of GDP. You look at a country like Norway, who's number 2, they're at $5,000 with 10% of GDP and better outcomes. Gary, I know you're focused on helping hospitals lower the cost of care. What are the drivers that you see in your business in terms of how hospitals can lower their per unit cost of care, and how can the healthcare system in general drive down that, per Joe's comments?
Well, first of all, it's important to understand that most hospitals, 80% of their costs are human resource related. So you hear a lot of hospitals talk about taking 20% of their costs out. Virtually impossible unless you can start to take some of the human costs out of it. And that's where we try to help hospitals, is leverage technology to become more efficient, to drive some of the costs out. I know we talked earlier about we have to stop thinking about care in the hospital, and we have to start thinking about the continuum of care. You're going to see under Obamacare patients be moved out of the hospital more quickly, so that means the downstream facilities are going to need to take higher acuity patients. They're going to have to be able to take care of them and make sure they don't go back to the hospitals, because the hospitals will get penalized for readmissions. So I think that whole push to push patients out quicker, to move them down the care stream, and quite honestly to get them home, which is where most people want to be taken care of anyway, versus institutionalized, is a push we'll see.
Yeah, I mean, so there's actually two-part answer to your question. One, in the comparison. I'll start with the unit cost, and I'll go with the concept. Our view of unit cost is exactly what you said. I mean, we simplify things. We put it into 4 major buckets: academic medical centers, community hospitals, physician, things licensed along physician license, like surgery centers, that kind of thing, and home. And anytime you can use technology or use resources to move an encounter of care from one of the buckets to the next bucket down, you save about 25% in unit cost. The efficiencies within a bucket, the efficiencies within a hospital are very overblown. I mean, we can get levels of efficiencies through its typical business operations, which we all know we don't need to repeat, in clinical operations, but you're talking single-digit 10% improvement. To get the big improvement, it's about, and in unit costs, it's about from one bucket to the other. And I know we're going to talk later about utilization, which is where it hangs up. The bigger global problem when it comes to the healthcare driver, that's not healthcare cost, but the cost of healthcare driver is really societal.
We will say, just generally, I mean, in this country, people want the best, and they want it now, and they want it for free. So those 3 things don't exist in other countries. This still is the #1 destination for medical tourism. This is where people come to have the most complex diseases treated, the surgical procedures. We are wide open here. That's not the case in other countries. The comparisons are often unfair, and I could whine about that all day. But what I would say about our own industry is we've not provided you and the general public with a contrasting, data point. We just sit there and we say, that's not right, or it's more complicated than that, or it's something else. But we are not offering up what it is our value, proposition is based on. And I think it's that access, the excellence, the outcomes that we have. If you're a cancer patient anywhere in the world, you want to be in the United States.
But let me play a little bit of devil's advocate there as a cardiac surgeon. Sure, if you need heart surgery, you have heart disease, you have an aneurysm, you want to come here, period. No doubt about it. But wouldn't it be better off to invest some money and make sure that people eat healthy and don't get heart disease? Because that's how other countries approach it, right? And other countries say, well, if you get heart disease, yeah, you're going to wait on the list forever to get heart surgery, but the trick is don't get heart disease. We just don't buy into that.
There is no doubt that we have significant societal challenges. I mean, 1 out of every 4 people in this country is pre-diabetic. Diabetes is a completely avoidable condition if you'll exercise and you'll watch your diet and you'll do a lot of other things that we all know that we're supposed to do. And we're not supposed to smoke, and we're not supposed to text and drive, and we're not supposed to do a lot of other things. It's how do we provide the proper incentives, the proper environment for folks to develop the right habits. And that's something that our system is very much invested in engagement in, is this development of healthy habits so that patients will take that proverbial ounce of prevention.